We need healthcare. We need people who care about people to be serving in healthcare.
You're listening to the Faith and Work podcast, where we explore ways to serve God and others in our daily work to bring life and hope to workplaces and cities.
Welcome to the Faith and Work podcast. My name is Ross Chapman. I am your host for today, and I serve as the CEO at Denver Institute for Faith and Work. We are continuing in a series called Voices from the Workplace, which we launched at the beginning of 2025. And throughout the year, we try to highlight different industries. And usually we have 2 episodes per industry. And this is the second episode in the healthcare conversation. Very excited for you to meet our guest today. But I want to just remind you that God doesn't need your good works, but your neighbor does, which is what Martin Luther, the famous reformer, said. And we love that phrase because it just reminds us that the ordinary work that we do and our daily responsibilities, no matter what our profession or industry is, it actually does meet real human needs. It's an opportunity to extend love, to extend mercy, compassion, and also provide for the needs and wants sometimes of the world. And so this series, Voices from the Workplace, is an opportunity for us to really get behind what's going on in the daily work of different industries that touch all of our lives. And in this case, healthcare is something we all experience. So we are really excited to introduce you to Dr. Matt Mahlberg and Cindy Chang Mahlberg. They work together and lead the Colorado Center for Dermatology. Matt is the founding physician for the dermatology centers, and he is a board-certified dermatologist and fellowship-trained dermatologic surgeon who specializes in Mohs micrographic surgery for skin cancer, laser surgery, and aesthetic dermatology. That's a really impressive sentence, and we are so excited to have his expertise on today. He's incredibly passionate about healthcare, and we're going to learn a lot from him today. And Cindy Chang Mahlberg is married to Matt, and she has her law degree from the University of Pennsylvania. And she has also been an analyst at the Federal Reserve Bank in Kansas City. She's been a corporate attorney, but mostly she sees herself as an entrepreneur. And when you hear from her today, you'll recognize that. Cindy also is a former board member of Denver Institute for Faith and Work, and we are so thrilled to have them because they're our neighbors. One of their centers is right across the street from our office. No matter where you're listening from and what your work is, you are going to be encouraged by Dr. Matt and Cindy. Matt and Cindy, welcome to the Faith and Work podcast.
Thank you.
Yeah, we're so glad to have you guys. You two have been around Denver Institute a really long time, like I think the very beginning. So it's really a joy to have both of you on and to hear from you and your journeys and how that has shaped you and how your work is shaping others. So let's just start there. How did each of you come to be doing the work you're doing together today? And then how did you begin to see it as sort of a primary way that you're expressing your faith and how you're following Jesus?
Great. Yeah, I think that we've really seen Denver Institute continue to grow. And I think in a lot of ways, our professional journey here back in Denver has grown alongside the Denver Institute for Faith and Work. And so it's been wonderful to kind of partner and walk alongside each other in that way over the last 10 to 15 years, really. Awesome. In terms of the healthcare field, I think I was always really drawn to the field of medicine and the opportunity it provides to directly serve people in times of need. I think my parents really instilled into me this idea that your work can be a vocation and that you really want to be have the opportunity to help people through that. And that can look so many different ways, but I think through personal relationships and I think interest in science and all those things, the idea of being a professional and having very specific technical skills available to help people in a way that brought their order back to disordered health. Mm-hmm. And I think that was always something that really appealed to me. Dermatology specifically was also something that I was exposed to early in my life. But as I sort of went to medical training and medical school, and you have to go through the whole career decision process, which is a big discernment, I was really drawn to the highly personal way that skin disease affects people. And my primary focus is in skin cancer surgery. So that's probably 80% of what I do on a daily basis. And much of skin cancer surgery is facial surgery under local anesthesia in a way that removes a cancerous growth or tumor and needs to be replaced with normal looking tissue or skin in a way that hopefully people look in the mirror again and see themselves and not, the work that I did. And that to me is something that's really rewarding. I think skin disease affects people a lot because it manifests on the outside of the body. And for the skin cancer surgery that I do, it's often on the face, as I said, and that affects how people perceive themselves and as well as how people perceive them from the outside. And so I think that idea of being able to heal people with those outward signs of disease was something that was especially meaningful.
Yeah, awesome. Did you always have a sense then that if you were going to jump into healthcare, that work would be somehow close to God's heart, or that you would be able to connect the dots between your own personal faith and what you did every day, or did that come later?
Well, I think Jesus was the ultimate healer, right? Mm-hmm. And I think there's lots of references to healing in the Bible. I think that the opportunity to, I guess, work through our own hands and heal people in some way was always something that was really appealing. And I think that interpersonal connection that we make with people in healthcare is something that's deeply part of our faith journey, right? I think connecting with people, finding ways to minister to them, whether it's something that they need or just emotional support or something that they need in terms of their faith journey. I think that is a very intimate place where medicine impacts people, and I think that that's highly unique, and I think something I was drawn to as well.
Yeah, that's great. Okay, Cindy, how about you? And feel free to give us a little bit of the journey of how you all decided you could work together, being married, because that doesn't work for everybody either.
Absolutely. So my perspective is going to be different because my journey to where I am now is different. Mm-hmm. I always say that for Matt, it was always so clear that he was called to be a healer. And, in the Bible, there's not a lot of specifics on giftings, right? Mm-hmm. But one of the giftings that is in the Bible is healing. Yeah. And Matt is somebody that from the moment you meet him, you just know that he was wired to be a caregiver and to care for people. And even his college roommates would just talk about him and his nature and who he is. And so Matt had a very clear sense of calling. And when he and I met in college, he really knew that he wanted to be a doctor. Mm-hmm. And for me, I had grown up as the first generation daughter of immigrants. And so my parents had the typical story of coming to the country with very little. And my mom opened restaurants when I was young. And her side of the family is extremely entrepreneurial. And I had grown up with this message of, Cindy, you're one of us. You're really entrepreneurial. You're really good at business and you're good with people. And so when we decided that we were going to get married shortly after college, my parents were not super supportive because they were like, this guy knows what he wants to do. He's going to grad school. What are you going to do? You're going to just sort of follow him? What is your path? And so at that point, I really didn't know exactly what I wanted to do. And I said, well, I'm going to law school. And they were like, you are? Why? And I just said, well, I think that because I don't know exactly what I want to do, I think that going to law school will be a good way for me to develop a really strong skill set and learn about the world. And so that's exactly what we did. And so we were able to study together and really just be part of each other's journeys. And I would say that it looks something like this. Matt was really enjoying his studies, and Cindy was really struggling with her studies.
You get good grades, though. Good grades.
I got good grades, and I did well, and I formed good relationships, but I was just like, I do not know if this is the work I'm going to be doing long term. So as we graduated and moved to New York City, where I was working in a big law firm doing corporate law, and Matt was doing his residency. And I think as he became more and more sure of his calling, I became less and less sure of my calling. Yeah. And that eventually led me to participate in the Gotham Fellowship, and that was just transformative. I think it was the first time I had been exposed to this idea that you can really live out your faith through your work and through secular work, right? Yeah. Not specifically ministry or nonprofit, but you can live it out through your work. And that really opened my eyes to this idea of redemptive work and having a vision for God's redemptive purposes and work. I still did not necessarily think that was me, Cindy, practicing corporate law on a day-to-day basis. But I really trusted that the Lord would bring that clarity over time.
Yeah.
And so when we moved back to Colorado and Matt was getting started in his career and taking his first jobs, I just started doing my own little entrepreneurial journeys, started an organization for women, started doing consulting with law firms. And then I discovered The Advantage by Patrick Lencioni. And I just felt like that book, his ways, just made my heart sing. I mean, it just made me have a vision of, well, this is how an organization could be, and this is how you can bring together groups of people in really good ways, agnostic of industry or work, and really make a difference in the world, right? And so when Matt was getting started in his career and encountering healthcare and with different types of organizations, I think the question that really impressed upon both of us was, is it possible to do really high-level healthcare and be in a really good place to work? How do we bring that all together?
Yeah, that's good.
And I think that I had this belief, this vision from what I had studied, from what I had known, that it's possible. I really think that we can do both. And so when he started this practice, it was just Matt and 2 employees. And we were so naive to just think that the organization would just sort of form with a lot of any other intentionality. It was just he could do his thing and it would be fine. So as it has turned out, I eventually found myself just getting deeper and deeper involved into helping with various things and taking on different pieces. And then realizing it took me, I would say it took me a solid 5 years to really get to the point of like, oh, I'm in this. I'm working with my husband and helping build this practice. Because up until that point, I really still drew a pretty bright line of this is his calling, this is his work, this isn't my work, I'm doing other work. But I think that the Lord in his graciousness has really provided this journey. And I think when we did fully embrace it and realize, okay, I think I'm in. I think this is how I'm going to be living out my calling for the time being. It really became not only a full integration of faith and work, but faith, work, family, and faith, work, marriage, and family, right? And so
it's no longer a side thing. It seems like it's a thing you're going to spend all of your working hours doing. I wanted to point out, you said you were part of the Gotham Fellows, and that's from the Center for Faith and Work in New York. And that is really cool. You know, Denver Institute and other organizations like ours have some of these 9-month fellowships. And we hear that story a lot of. That's been a very impactful way that people have kind of reconsidered what does God think about work and how does that apply to my life. So fun to hear that part of your journey for sure. And I think it's amazing that you guys are working together. What an awesome thing.
It was a really long recruiting process, I like to say, to get Cindy on board. And statistically, there's fewer and fewer physician-owned practices in the world. And we could talk about the good and bad of that. But a physician just rolling up their sleeves with a couple of employees and hoping that it all works out, it works for a while. But then, it becomes complicated in a hurry.
And more patients.
I think, through the blessing of a growing practice and adding physicians and these things, you really do need amazing administrative and leadership help. And so that's what Cindy has brought to the table for our organization. I think we wouldn't have grown at all in the same way had it just been a doctor and, rolling up his sleeves, et cetera.
Well, the episode title is called The Work of Care, playing on that idea of it takes a lot of work to create a caring practice. And you two are working together in such an awesome way. Well, speaking of healthcare, but give us your best 1-sentence answer to the question, what's God's vision for healthcare? Or you can apply it to specifically dermatology if you want.
Healthcare is a vocation for individuals or communities to participate in God's love and redemption through healing and restoring the health of others. And I think that, there's lots of examples of that, right? This is healthcare in the big H word version. But you can have, Mother Teresa and the Missionaries of Charity, right? There's a community of people that are providing that vocation, private practice physicians, large healthcare organizations, government agencies. And I think if everyone sort of distills it down to that, as opposed to lots of acronyms and dollars and cents studies and things like that, that's really what God's after. And I think that God calls us to live out his love for others. And that's the vocational aspect of it. I think there's a general vocational call to holiness that I think that we're all called to, and this is one way to live that out, very specifically through a career or vocation.
Yeah, that's great. Okay, so now I want you to apply that to like a typical patient interaction then that you have, on the regular. Tell us like what's happening, but also like how you're trying to apply that vision that you articulated. In that moment.
So I'll kind of walk you through one of my more typical patient interactions. And most commonly, I'm doing skin cancer. And so skin cancer is, like I said, a sun-related, ultraviolet-related, caused malignancy or tumor on the skin. It's most commonly on the face. And these things have been recognized for thousands of years. In fact, one of the earliest definitions of basal cell carcinoma, which is the most common type of skin cancer, was described by a guy named Cornelius Celsus. He lived from 30 BC to 50 AD, so the time of Christ, right?
Wow.
So
amazing.
basal cell goes back to the days of Jesus.
I'm getting an education.
I know, there you go. So historically, these cancers would cause incredible disfigurement, right? There's melanomas, which are the cancers that look like a mole, and those can metastasize and shorten people's lifespans. But the more common one is basal cell carcinoma. And this causes incredible disfigurement of the face, facial skin, if it's not treated. So my typical patient interaction that might happen is a patient's referred in from another practice asking me to specifically take care of this cancer. Let's say it's someone's nose. So it's right in the middle of their face. And they come in, perhaps meeting me for the first time on the day of surgery, to come in for a local anesthesia procedure that we're going to remove that cancer surgically, and then we have to find a way to fix it and replace it in a way that they leave, and heal in a way that they see themselves and not our surgical scar. So I think that the thing that happens there is we're participating in God's love and redemption, first of all, through building understanding and building trust. So you have to create an environment, whether that's from the very moment they walk in the front door and how they're greeted by our team, all the way back to the patient encounter. Now, what I'm encountering is more in the patient encounter. So I have to have them understand the problem, and they need to understand why we're doing what we're doing. And they have to trust that we're going to walk them through that process in a way that they're going to have a good outcome. Yeah. And there's a vocational sense in that, just because you can't just tell people, here's what I'm going to do. Like, there has to be this sort of intimate moment of you understand what I'm saying, and you are emotionally okay to proceed with what we're about to do. And I think that even in that very moment, there's a lot of, there's a spiritual sense in the room that has to happen, because you need them to be on the same page. Whether it's just, the first injection with local anesthesia, are you creating as painless a process? Are you empathic to their need to not feel pain? And are you injecting that in a way that doesn't hurt, hopefully, or hurts the minimal amount possible? And those are operational things that we can do as a practice and as a team to achieve that. And as you walk them through the day, through each step, do they continue to trust you that, hey, we have to take more cancer out of your skin. We're seeing it under the microscope. We need to take more. And then ultimately, we're going to do this skin flap where we move your skin around. And ultimately, even though there's going to be 55 stitches, it's going to look great in a few weeks. And so that's a big jump to go from the moment of coming in the morning with their Starbucks coffee in hand to leaving with a big bandage on. And I think a lot of what happens there is a moment where you can, pour out your the love of God to them, right? And that's not something that has to, as we verbally said, but I think in just the way you behave and the way that you care for them and the way you minister to them. Yeah. I think that's the real challenge. So it's a challenge that I love every day. It's a challenge that I love to bring our team alongside, because there's a team of 4 or 5 people working alongside me to do that in a patient encounter. But that's and we're doing that multiple times a day. So.
Hi, my name is Parker Nabnett. As a financial advisor with I Am Financial, I am enriched by Denver Institute's programming and content, including this podcast. I love Denver Institute's mission to prepare people to serve God and others in their daily work so that workplaces and cities are transformed. I know my monthly donation gives the organization I love reliable support. Plus, I get great benefits like free or reduced admission to events and access to digital content. To become a monthly partner, please visit the Give page at denverinstitute.org.
Help us reflect a little bit on how, just the average listener may not be working in healthcare, but we all experience healthcare, right? We're all going to need to see a doctor, or we're going to end up in a hospital, or whatever, or we're going to be supporting somebody. Like, is that the normal kind of process that your peers do, or that you would hope? Certainly you'd hope that for them. Maybe that hasn't been the experience of patients necessarily. How would you encourage people who might have just a little apprehension about that?
Well, I think that whenever you go into a healthcare encounter, there's so many different types. You can go in for a consultation to talk about your elbow pain, or you could be going in for, checking your eyes or whatever. But I think in any case where you encounter a healthcare provider, I think that it's important to know that person very, very likely went into the field for the right reason. Mm-hmm. They want to care for you, right? And there might not be the Christian ethos behind it, but there very well may be. But the idea is that they want to care for you. And there's a tremendous amount of work that went into preparing for that 5-minute encounter, 10-minute encounter, 15-minute encounter, 30-minute encounter, whatever it is, even though from a patient side of things, it seems like, is that it? Mm-hmm. It's pretty short, right? Yep. But there's a tremendous amount of work that goes into actually preparing to have that encounter be as productive as possible. And this is where, like the work that Cindy does for the practice is tremendously helpful and makes a huge difference in sort of helping that happen, but also on the medical side, like our whole team's doing a lot. So I think that when you have that encounter with a medical provider, know that there's a tremendous amount of work that goes into it. Know also that there's a tremendous amount of bureaucratic excess that we have to work around given the system of healthcare that may be somewhat distracting. There's so many decisions that are being made very quickly, and there's so much that goes into all those decisions, whether it's educational background or all the work that preps for the appointment, that even if the moment for a patient doesn't seem like it's enduring or that long, I just would hope that people know that there's a lot of work that goes into each of those moments. And there's a lot of sacrifice that I think healthcare workers give of themselves to create those moments. Again, whether it's spiritually driven by Christian theology, or if it's just because their mom wanted them to be a doctor, whatever it is, I think that a lot of the things, there's a lot of motivation to do the right thing for people. It just doesn't always come across that way. Yeah, no, that's super helpful. I appreciate you taking the time to help us think about that. Cindy, when we walk into a healthcare clinic, we usually talk to somebody up front, sit down, and go see the doctor or nurse or whoever. We're not really thinking about the business side of what we're entering into. So help us think about that. What does it actually take to run a good practice? And you're thinking of it as kind of your entrepreneurial journey, and now you're thinking about healthy organizations and how it enables kind of that vision of healthcare to be lived out in your place. Help us, what's on your brain? What are you thinking about? How does that work?
Yeah, this is a great question. So I think that whether you're in the business of selling a product or providing a service, it's really important to understand that fundamentally in a business, you are trying to build a relationship of trust with the consumer, right? Whether it's a patient or a purchaser. And so when you apply that to what I call the business of caring for people, the biggest thing is that really what we're selling is our service, our knowledge, the knowledge of our well-trained, well-educated doctors and physician assistants and providers who have spent a lot of their time trying to become the kinds of people that are trustworthy. And so what we really build around in a lot of our policies and procedures is how do we be an organization that does what we say we're going to do, right? And so that sounds so simple. We say that this is your issue, this is how it gets cared for, you're going to take this prescription. And so how do we create an experience for our patients where what they are told is then what happens. And I think that simple concept is really what has driven a lot of how our organization has been built, right? So we have our vision statement, our mission statement, our core values, and those have really withstood the test of time. We casted these ideas at the beginning, and especially our core values and how we operate and who we are. Those have really encapsulated what we stand for. And
can you share a couple of those core values?
Oh, sure, yeah. So our core values are help first, personal excellence, expert-mindedness, genuine enthusiasm, and creative cooperation. And so we have taken those ideas and really tried to weave them into everything, from our employee handbook to our workflows to our financial policies, all of it. And what we tell our people constantly is we are not perfect, but we try to make things right. And our policies and procedures and workflows are human-centered. And so if it ever appears that we're doing something that is out of alignment with our values or that is prioritizing something other than people, let's do something about it and let's make it better. And so we really try to promote that within our culture. And I think we have a team of people that are really invested in our vision and in our mission and who are willing to speak up. Now, one of the challenges I would say is that as we've grown to now nearly 50 people, every season, every stage has different challenges, right? It was much easier when we were a size where Matt and I could have personal relationships with everybody who worked on our team. But now that we have more and more people and we are serving, I think, close to 40,000 visits last year.
Wow. Yep.
That's a lot of people. And so it's a lot of people to do what we say we're going to do for, right? And to make sure that that happens time and time again in the interaction and the experience. And so I think trying to make that come to life with a group of people who are human and have their ups and downs and are subject to burnout and are subject to feeling discouraged. And so I think that on the flip side of all of our systems and processes is also building a culture that can care for the people who are caring for people.
Yeah.
So, it's interesting because in healthcare, I think that a lot of the people, there's such a wide variety of people that are all working together. You have the doctors who have gone to years and years of schooling to then maybe your entry-level positions may or may not have even finished high school. And so you have a wide variety of people with different backgrounds and educational exposures. And so trying to have everybody work together and to help everyone understand and believe that their work matters is such a journey. And for us, we have built a very intentional career path structure for our team members. And so we try to really help people understand, okay, when you're coming into our organization, we are not only teaching you how to work in healthcare, but hopefully we're giving you skills that are transferable and that will positively impact any relationship that you have, right?
A lot of intentionality is what I'm hearing all across the board for you guys. Matt, help us reflect on how you would say this work has shaped you. At Denver Institute, we talk a lot about, I would frame it as our work is forming us, and it's also the way that God is forming his world. So it's sort of missional and also about who we're becoming. Maybe just share one thing that's surprised you or stretched you in a way that maybe you just, after being in it a little while is more clear that it's actually shaping you into a certain kind of person.
It's a great question. I think one of the things that's really stretched me or kind of provided ways to grow in both character and faith is when things don't go perfectly, right? And you think about that in patient outcomes. Patient outcomes in dermatology are really good, right? We cure cancers consistently. We have very high cure rates, low recurrence rates in terms of the skin cancer surgery we do with Mohs, micrographic surgery. But sometimes, we live in an imperfect world, right? Humanity is imperfect, and we're not in heaven yet. And so sometimes health or medicine doesn't fix things. It doesn't cure the cancer, and patients have an outcome that's poor, right? And they go on and their disease progresses despite doing all the right things, sending them to the right colleagues, et cetera. And the humility that comes along with that, to remind ourselves that, we might be running an organization of lots of people, and we might have done all the right steps and studied all the right things and done all the right treatments, but sometimes life is imperfect and we're not in heaven. And so I think that walking alongside people, and this is where that vocational aspect of medicine really comes in, but walking alongside people when things are not going well is one of the biggest ways to grow, right? You form relationships with people because they know that you care about them and that you continue to pour into them even when things are not when they're having bad outcomes, or they have a family member with a bad outcome. One of my most impactful moments that I've ever had as a physician was a patient who had a progressive disease, a progressive type of leukemia. We had treated him for so many types of skin cancers, and his leukemia was progressing in a way that he was going to pass away within, weeks or short number of months. And he scheduled an appointment with me just to say goodbye, right? And I think about, I didn't offer anything for him that day, right? I was not treating his disease, wasn't making him better, but you have an impact on people and they impact you. And so I think that impact on you as a provider is something that you realize it's a two-way street, I guess, over time.
Yeah, that's beautiful. Yeah, you're working on the outside appearance in your healthcare, but it's actually an internal healthcare as well, you could say, which is really powerful. We're wrapping up our time a little bit. So Cindy, I want you to help us think about healthcare from your business perspective, but also seeing it up close. I've heard you talk about like your hopes for healthcare, and you want people to feel excited to work in healthcare and like help this vision move forward. Like, I don't know, what would you encourage people who are considering working in healthcare, or maybe they're considering not working in healthcare anymore? How would you encourage them?
Gosh, I think that what I would say is, I don't know if this is true, but I like to say that healthcare is the original social enterprise. There's so much talk nowadays about social entrepreneurship and ways in which you can do good and do well and impact the world. And there is nothing more human than our bodies. That is what makes us humans this side of heaven, right? We have these bodies that we're in. And so for people who are considering healthcare, whether as a provider or on the administration business side, I think that as an industry, as a field, I don't think that there's any other field where truly every single day, every moment, everything that you do is about caring for humans and caring for the body. And the impacts that you're able to have, whether on a one-on-one patient-provider level or at a more macro level, building the systems and the operations and the policies and the procedures, it is such a tangible way in which to bring about healing at so many different levels. And we need healthcare. We need people who care about people to be serving in healthcare. We need people who want to do good and to bring comfort and peace this side of heaven to be in healthcare.
Oh, I'm fired up. That's awesome. Thank you for sharing that. And then just final word from you guys is just, if general audience, if they're thinking, I want to think better about integrating my faith and work. They've heard your story of how it happened for you guys. Where would you encourage them to just get started?
Let me just echo what Cindy was saying too, because I think this is part of it, is that when people are thinking about, merging their faith and their work, I think that the whole person and being all in is something that people resonate with, and a lot of times we see young people go through these healthcare career decisions, like what do I want to do, which healthcare type of position do I want to do? Do I want to be a physician assistant or a doctor or whatever? But I think that the big thing about healthcare is that it's integrated with your life. I mean, it is an emotional journey, both the educational part of it and the practice of it. And so your faith is naturally integrated with it, because it's all of you, right? It really does require all of you. And I think that's a really rewarding part of the career. A lot of times there's this idea of, well, I want to just sort of like have a little job on the side so I can really live life. But I mean, living life is interpersonal interactions. It's being part of your community. It's engaging people with the whole self of you, including your faith. And I think that is a real opportunity for people to pursue healthcare careers. But with regard to the idea of ideas to, I think Cindy will have a lot of great resources too. One of my favorite books in the last 2 or 3 years was a book called From Strength to Strength by Arthur C. Brooks, which I think anyone in there, especially as people are in their 30s, 40s, 50s, it's worth reading about how your abilities and your strengths at different, iterations of life can really shape, how you can impact the world through your vocation.
I would say, because my journey has been less clear-cut, right? And I've wrestled a lot with purpose and how do I use my gifts and talents? What are my gifts and talents? I think that for people who are really trying to understand how do I integrate faith and work, I would say bloom where you're planted. And, the intersection, as Tim Keller says, of ability, affinity, and opportunity. His book, Every Good Endeavor, is so foundational to understanding that everything that we do is an opportunity to worship the Lord. Everything that we do is an opportunity to present work as worship. And so this idea of integrating faith, life, work, I think that it happens as long as you're not trying to prevent it from happening, right? If you're living life in such a way where it's like you've got your boundaries, you've got the rigidity, and this is where work is, and this is where life is, and this is where I worship, then it's really hard to have space for the Lord to show up and to realize like, wow, I need to fire somebody right now, but I can do that in a way that is glorifying and pleasing to the Lord, where I am living my faith as work right here and now, to the amazing moments of putting on these huge celebrations and events. There's so many ways in which we can live out our work or live out our faith in our work. And I would just encourage people who are on this journey to really be open and to just surrender and to listen to where the Lord is speaking, because I don't think that God is trying to hide it from any of us. Don't think he's trying to make it a difficult path. I think sometimes we get in our own ways and we don't just live.
Right on. Well said. And thanks for sharing so much. And we're just so glad to be your neighbors, actually, across the street from our office. And just thanks for sharing today. Thanks for being on the podcast.
Thank you. Thanks.
Well, just a final thank you to our guests today, Matt and Cindy. We are so thrilled that you joined us. Thank you for giving us your time and sharing with us a little bit about how healthcare works. Really, it's the business of care. And it was a really incredibly insightful opportunity for us to understand what's behind the work that goes into when we enter the room as a patient with a medical professional, and also the business and acumen that it takes to lead a practice in the ways that you guys are. So both of you, thank you. So audience, as you listen in, what did you hear? What do you want to take away from this conversation? Maybe it's simply an encouragement that there's some really good work going on in the healthcare industry, and we can have a little more confidence maybe than we had before. Maybe it's just the recognition that your everyday work is an opportunity to provide care through the daily tasks and responsibilities that you have. Watch for that opportunity and then do something with it. If this conversation helped expand your imagination just a little bit about how to integrate faith and work, we'd love for you to share it with someone else who you think might need the same shift in their work. Thank you so much for listening in to the Faith and Work podcast. Again, my name is Ross, and if you want to check out either of the books that Matt or Cindy mentioned, you can find that in our show notes at denverinstitute.org. Thanks for joining us.
If you've enjoyed this episode of the Faith and Work podcast, please subscribe, leave a review, or share it with a friend. The Faith and Work podcast is produced by Denver Institute. We believe that when Christians work faithfully, the world will taste the hope and life that Jesus provides. To learn more or to make a financial contribution, visit denverinstitute.org.